Hi, I'm Dr. Roger Lucas, and I'm a pediatric dentist and author here to teach you how to brush your child's teeth like a dentist dad does. My view on brushing is that quality counts more than quantity. Based on the cavity patterns I see, I would prefer that you brush your child's teeth for 20 seconds a day until they're 6 or 7, instead of having them brush on their own twice a day and missing a lot of the spots. Now, you can only get away with this less brushing method based on two conditions. One, you know exactly how to get the difficult to reach spots, which I'll show you, and two, that you give your child the right snack foods. If you give your child the wrong snack foods, which are sticky and stay on their teeth, you need to brush their teeth 5 times a day. If you give your child the right snack foods, then you can get away with brushing just 20 seconds a day. Like I'll show you. When your child starts brushing on their own around age 6 or 7, that's when you transition to 2 minutes twice a day. Okay, now let's show you how to brush like a dentist dad does.
As a pediatric dentist, I see all the areas that are hard to brush. So I'm going to show you how to brush your child's teeth. So the 3 different areas you want to think about brushing are the biting surface. These are the easiest to access, and the biting surface is where most people think to brush. Also, the outside of the teeth. Of course, in the front, that's usually pretty easy access. In the back, on the outside, it's a little trickier. I'll go over that in a minute. And then finally, on the inside. So if you think about it, on the top and the bottom, there's really 3 areas. The biting surface at the top, the inside, and the outside. When you're actually brushing your child's teeth, you want to break this into 2 separate steps. There are certain spots in the mouth that you can brush easily when the mouth is open, and certain spots you can brush when the mouth is closed. So a lot of the areas that are missed are the areas that are actually easier to brush when the mouth is closed. And next to the tongue, it's also difficult. So we'll go over those. So when you first start brushing, it doesn't really matter the order, but let's say you just start with the mouth open because that's easiest. So you start with the mouth open, and then it's very easy to get the biting surface on both the top and the bottom. And if you're eating the right foods that don't stick to the teeth, this actually won't take that long. There won't be anything to brush off. For example, if you eat a fresh apple, the food's not staying stuck on the teeth. If you eat dried fruit or maybe a processed dry starch, such as a cracker or cereal, that'll stay stuck and you'll need to have more brushing to do. So we've got the top surface, very straightforward. And now inside, when you're open, again, the inside is easiest. In the back, top, it's pretty easy access, but just make sure to get back in the gum line the inside. There's not much in the back up here. And on the bottom, it's a little trickier because the tongue is in the way. So what I find is instead of the holding toothbrush and pushing it straight back, if you actually push down there and push straight back, it's very easy, especially for kids with a strong gag reflex, to not like that. And they'll go, it's almost like you're choking them each time. So what I do instead is hold the toothbrush vertically and push down, and you can get that really hard to reach spot next to the tongue that a lot of kids find uncomfortable. And you can still brush it so there's not bacteria sitting there all week, and it's not as gaggy. And you basically just go in there for a second, and it's not as comfortable if you go up and down. So see how I'm holding my toothbrush vertically up and down to get that spot, as opposed to pushing back every time. That's a really tricky spot. It's easy to miss, but if you know that trick of going up and down, it'll be much easier. Back behind these teeth, of course, is usually fairly easy. So now we've gotten the top surface, we've gotten the inside, showed you the trick next to get to the tongue. And now finally, here's the other trick. For the outside, it's actually easier to have your child close their mouth. Once they close their mouth, then you can stretch out their cheeks and get this front spot so it looks like they're brushing in a commercial. And actually, to get back here, this is very easy to miss, especially with kids with tight cheeks. If you have them close their mouth, you can stretch out their cheeks and get back here more easily on both sides. So the real trick to get that outside of the back teeth is actually have them, when you're all done opening, close so you can stretch out their cheeks and get there. The whole process of brushing the teeth when you're helping your child doesn't have to take a full 2 minutes to get everywhere. As long as you know exactly where to go, you'll be able to get all those troublesome areas faster than your child could if they spent 2 minutes. I guarantee you, if you have a 3 or 4-year-old spending 2 minutes brushing their teeth, they're never going to get those hard to reach areas, no matter how long they try or how dexterous they are. I suppose there's always a few Michelangelos. But just that 20 seconds of you helping brush your child's teeth, you'll get all those hard to reach spots if you know exactly where to go, and they'll be much better off for it. I recommend to help your child brush their teeth until they have at least the dexterity to tie their shoe, which is usually around age 6. And of course, it depends on the child. And you also want to make sure to check that they're getting it. Some kids, you need to help until they're much older. I wouldn't really recommend to have them do it on their own any earlier. Okay, thanks.
All right, and we're going to use our model. I just want to show you what toothbrushing looks like in real time. We have our great helper. Can you wave hi? Okay, she's going to be a good helper for brushing her teeth. So, I'll open up really big. So we're going to start getting the biting surfaces on the top and the bottom. You don't spend much time. And then we'll get the inside next to the tongue. And then we get the inside on the top, and she's open. She's doing a great job. And now we've got on all the inside surfaces. So now close, smile. We get the front, and we get the back. And we get the back and outside, and that's really all it takes. We got everything we need to in about 40 seconds. Can you give me 5? Awesome job.